This PowerPoint, let me discuss few question and answer. And this PowerPoint basically focused on cardiology. It is part of the adult health or medical surgical part of nursing. The first question here, a nurse on the telemetry unit and is faced with a various situations. Which situation take priorities? Number one, a client cardiac monitor suddenly reveal sinus tachycardia with isolated premature ventricular contractions. Number two, a client cardiac rhythm suddenly change from normal sinus rhythm to uncontrolled atrial fibrillations. Number three, a client is requesting to help to go to the bathroom. And number four, the cardiologist is asking a nurse to make round with him to his client. Out of four patients, which patient is the important or priorities you have to check first? Let me tell you. Number three, if you will be get late or if the patient will be late to go to the bathroom, he or she will not die. So number three is not a important. Number four, cardiologist asking the nurse to make the round. So if you be late 5 minutes, cardiologist will be wet and nobody will die. So 3 and 4 is no values. Now talk number 1 and 2. So number 1, a client cardiac monitor suddenly reveals sinus tachycardia with isolated premature ventricular contraction. So sinus tachycardia means it is the faster heartbeat, or I said sinus tachycardia is a fast but steady increase in the heart rate where the sinoatrial node send electrical signal is a quick rate, easy. Sinus tachycardia means faster heart rate that is origin is the sinus or AC node. Number 2, the client cardiac rhythm suddenly change from normal sinus rhythm to uncontrolled atrial fibrillations. It is definitely it is important. So it is every student must know what is the understanding of sinus rhythm. Correct answer said number 2. The client cardiac rhythm suddenly change from normal sinus rhythm. So what are the normal heart rate origin from AC node? We call sinus rhythm, and it is normal. But normal heart rate or normal sinus rhythm suddenly change to uncontrolled atrial fibrillation. So again, let me focus a little bit. Sinus rhythm means normal sinus rhythm. And normal sinus rhythm is defined as the rhythm of a healthy heart, nothing abnormal. And sinus rhythm, arrhythmia, is the same thing, different way to talk. When your heart or heartbeat is too fast or too many or too few times in a minute, this is called arrhythmia, not normal, either slow, below normal, or faster than upper limit. Both are arrhythmias. So sinus rhythm change to atrial fibrillation. This is pathology. So Atrial fibrillation is a disease of the heart characterized by irregular and often faster heartbeat, faster than the upper normal limit. So you have to evaluate it. Rational said the client cardiac rhythm suddenly changed from normal sinus rhythm to uncontrolled atrial fibrillation takes the priorities. Maybe again, if atrial fibrillation is not controlled, it can cause the heart failure or arrhythmias, cardiac shock. So this cardiac rhythm change may cause clot or slow from atria, placing the client at the risk for a stroke. What is stroke, right? Stroke, also known as cerebrovascular accident, shortly called CVA. So stroke occurs when the supply of the blood to the brain is reduced or blocked completely. So you see, this is the blood vessel is ruptured, blood clot formation, and weakened blood vessel rupture, blocking, or clot formation, right, in the brain, right? So stroke, which can prevent the brain tissue from getting the oxygen and nutrition, and it is called the damage in the brain. So the client cardiac monitor revealed sinus tachycardia with isolated premature ventricular contraction is not an experience of life-threatening situation. They will not die. Therefore, he does not take the priorities. The nurse may ask her other staff's member to assist the client to the bathroom or making a round with the cardiologist. The next question here. A physician has scheduled a client with a mitral stenosis or mitral valve replacement, which condition may arise as a complication of mitral stenosis. So my patient have a mitral stenosis because of mitral valve replacement, or need to surgical operation mitral valve replacement because of mitral stenosis. What is mitral stenosis or mitral valve stenosis? An easy way to say narrowing of the mitral valves or arteries in the heart. And if you did not treat or untreated, this result in the patient feel tiredness, shortness of breath, easily fatigue and tired. We need treatment, need valve replacement. So this is which condition may arise as a complication of mitral stenosis, left-sided heart failure, myocardial ischemia, pulmonary hypertension, or left ventricular hypertrophy. So correct answer said mitral stenosis lead to pulmonary hypertension. So here we can see normal anatomy of the heart and lungs. So heart and lungs is connecting, right? So blood gets inside the right atria, then right ventricles. From right ventricles, blood supposed to go to the lungs, where it would be oxygenated. And oxygenated blood come back to the left atria, from left atria to left ventricle. From left ventricle, blood supposed to go to the arch of aorta and distributed all over the bodies. So heart and lungs work coordinately work together. But if any pathology occur and increase the pressure inside the lungs or artery in the lungs, venous system in the lungs, we call pulmonary hypertension. So, what is pulmonary hypertension? Let me explain one more time. So, it is a condition in which the high blood pressure affected the artery of the lungs or right side of the heart, and this results in the chest pain or shortness of breath. Rationally said, mitral stenosis or severe narrowing of mitral valves impeded the blood flow through the stenosis valve, increasing the pressure in the left atrium and pulmonary circulations. These problems may lead to low cardiac output, pulmonary hypertension, edema, and right side heart failure. Other potential complications of mitral stenosis include moral thrombi or pulmonary hemorrhage and embolism to the vital organs. Myocardial ischemia may occur in a client with a coronary artery disease. Left ventricular hypertrophy is a potential complication of aortic stenosis, not the mitral stenosis. So here we say aortic stenosis. What does it mean? Means it is the narrowing of the heart aorta or aortic valve. The valves which is separated the left ventricle and aorta. Means stenosis is up there. So here we can see when it is related, right? Question about the pulmonary hypertension, but I want to recap. I want to remind you what are the nursing care or intervention of hypertensive patient, hypertension nursing care. We could measurement the daily weight, also keep record input and output, how much fluid they intake and how much output, urine output, response to the blood pressure, then electrolyte monitoring, take the pulse regularly, or ischemic episode or TIA, transient ischemic attack, or other complications. So when a patient admitted as a hypertension, with a hypertension, so as a nursing care, the primary nursing responsibilities for long-term management of hypertension are assist the patient to reduce blood pressure and complying with the treatment plan. So nursing action include patient and family teaching or educating, also detect and reporting of adverse treatment effect or compliance, assessment, and also improvement or evaluation of the therapeutic effectiveness is also included in nursing care of the patient who have high blood pressure. What next? A client hospitalized for treatment of hypertension is being prepared for discharge. Which teaching topic should the nurse use to cover? Number one, maintaining a low potassium diet. Number two, skipping and medication dose if dizziness occurs. Number 3, maintaining the low sodium diet. And number 4, the receiving IV antiarrhythmic medications. So if students have common sense, they should answer this question, right? So who are hypertensive and what you educate them teaching about include into number 3, maintaining the low sodium diet. So if your patient has a high blood pressure, definitely our target low the blood pressure, right? Keep it note. So we try to certain lifestyle change and treatment for underlying condition that could be help or could be recommended to reduce the blood pressure. So beside of antihypertensive agents, always we have to educate them about the food that is regulate the blood pressure, right? It is also important to self-education. So like here, this rationale says the nurse must teach hypertensive client how to modify his diet to restrict sodium and saturated fat. In addition to teaching about adverse effect of ordered antihypertensives, she must discuss action and doses of these drugs. A client receiving antihypertensive may also take a diuretics as part of drug regime and thus may require dietary potassium supplement and high potassium foods to avoid electrolyte disturbance. Instead of skipping medication if dizziness occurs, the client should notify physician of these symptoms. The client receiving antihypertensive at home takes them by mouth, not the IV. Next question here. A client look for medical attention for dyspnea. Dyspnea means shortness of breath or difficulty of respiration. So next here, patient also complain chest pain, syncope. Syncope means fainting, means temporary loss of consciousness, syncope, fatigue, and palpitations. A thorough physical examination reveals an apical systolic thrill are present, along with a fourth heart sound, S4, and systolic murmur also there. Diagnostic test reveals that the client has a hypertrophic cardiomyopathy. So before to explain hypertrophic cardiomyopathy, I want to tell you what is cardiomyopathy. Whatever, which nursing diagnosis may be appropriate. Number 1, decreased cardiac output. Number 2, risks for deficit fluid volume. Number 3, ineffective thermoregulation. Number 4, risks for peripheral renovascular dysfunction. Correct answer said decreased cardiac output. So in these two pictures, this is a normal heart and this is the wall and septa separated two ventricles and atria. Here we can see some pathology where the wall is thicker. So when wall is thicker, room is get short, narrow, space going reduced. So as I told you, cardiomyopathy, what it is. So cardiomyopathy, an acquired or inherited disease of the heart, disease of the heart muscle, which makes it difficult for the heart to pump the blood to other parts of the body. So you see, heart wall or thickness is increased. So this heart will not pump the blood like the normal heart, right? So this situation we call hypertrophic cardiomyopathy. It is also known as hypertrophic obstructive cardiomyopathy. So a cardiovascular disease is hypertrophic cardiomyopathy, and that is characterized by an abnormally thickening or thicker heart muscle. And most of the people may not have any symptoms, and few may develop symptoms which are progressive and can cause serious heart disease. So definitely the how normal heart pump and cardiac output, definitely it will not like this. So cardiac output will be decreased. So they said decrease the cardiac output in an appropriate nursing diagnosis for a client with a hypertrophic cardiomyopathy, because hypertrophied cardiac muscle decrease the effectiveness, decrease the effectiveness of the heart contraction, also decrease the cardiac output. Heart failure may complicate hypertrophic cardiomyopathy and causing the fluid volume excrete. Therefore, the nurse diagnosis of risk for cardiac fluid volumes is not applicable. Ineffective thermoregulation and risks for peripheral renovascular dysfunction are not inappropriate, because hypertrophic cardiomyopathy does not cause this type of problem. So same picture look like bigger here. We can see how thick the ventricular wall and interventricular septa, and it is very narrow, the chamber of the heart, and heart muscle does not pump normally. So cardiac output will be reduced. Next question here. A nurse is caring for 4 clients on the cardiac unit. Which client has the greatest risk for contracting ineffective endocarditis? Number 1, a client 4 days post-operative after mitral valves replacement, right? And next one, a client with a hypertrophic cardiomyopathy. Number 3, a client with a history of repaired ventricular septal defect. And number 4, a client 1 day post coronary stent replacement. So greater risks contracting infective endocarditis. So to read this keyword, you can get some ideas. Is endocarditis an infection, infective? So inflammation of the inner layer of the heart or inner layer heart chamber and valves, infection I say, and inflammation, and usually occur by bacterial infection, right? So out of 4 patients, which patient tends to get infection, right? Definitely the patient who will stay a longer time in hospital, a client 4 days post-operative atrial valve replacement. So chance to get infection, right? So rationale said having prosthetic cardiac valves because atrial valve replacement, mitral valve replacement is called prosthetic valves. Replacement at the risk for infective endocarditis, right? So if patient have infective endocarditis as a healthcare provider, we should easily find it out, would see the sign and symptom. And symptom depends on the disease causes the organism or can vary from person to person. But most common symptom we can see heart murmur developed or muscle and joint pain, fever and chill, also shortness of breath or swollen foot, most common sign. So hypertrophic cardiomyopathy and repair ventricular septal defect are moderately risks for infective endocarditis. They said greatest risks. Coronary stent placement is not the risk factor for infective endocarditis. Next question. A client is returning from the operating room after irregular hernia repair. So the nurse noted that he has fluid volume excrete from operation and is at the risk for left side heart failure. Which sign or symptom indicate left side heart failure, right? So number 1, jugular vein distension. Number 2, right upper quadrant pain or by basilar cracks or depending edema. Correct answer is by basilar cracks.
When she put us in the picture there, after them not far from campus
means here rational said the crackles are a sign of alveolar fluid. A sequence of left ventricular fluid or pressure overload indicate left side heart failure. Jugular vein distension or right upper quadrant pain or depending edema are caused by the right side heart failure, right? So particularly heart failure, I said the common terminology, heart failure, but we can categorize left side heart failure and right side heart failure. So heart failure, also known as congestive heart failure, congestive cardiac failure. So it is a progressive heart disease that affected pumping action of heart muscle. And this caused the fatigueness or shortness of breath. So as I told you, sometimes we said left side heart failure, sometimes we said right side heart failure, right? So this is the right side heart failure, right atria, right ventricle, left side, left atria, left ventricle. So if the pathology in left side and heart failure because of the left side does not work. So some of the common signs of the left side heart failure are as follow. Here we can say left side heart failure, the sign like decreased cardiac output, pulmonary congestions, because blood comes from lungs to left side of the heart. But if the left side doesn't work, blood will not forwarding forward. And blood supposed to go back. And go back means go to the lungs. So lungs congestion, shortness of breath, impaired gas exchange, pulmonary edema develop, patient complain cough, orthopnea means when they lie down, shortness of breath increase, or at the night time increase. It is called paroxysmal nocturnal dyspnea. On the other hand, impaired gas exchange can cause cyanosis, blue discoloration, also decrease the cardiac output, activity, intolerance, and sign of decrease the tissue perfusion. So persistent cough or with blood or frothy mucus, it is the cardinal sign of left side heart failure. Shortness of breath, especially when patient lie down on bed or wake up from sleep due to the shortness of breath, a common sign. Also, patient generally feel weakness, fatigue. So heart failure can be classified based on the side of the heart involved, either right or left. When both, we call both side heart failure. So according to the portion of cardiac cycle involved, even systole or diastole. So left side heart failure is typically similar to the systolic heart failure, although there are some cases that may involve the diastolic heart failure too. So when patient has a right side heart failure, what we can say? So right side heart failure, failure of the proper functioning of the right ventricle. So it is the right ventricle, it's here. Or subsequent engorgement of the systolic vein, producing pitting edema because it is that communicate with superior and inferior vena cava. So you can see pitting edema, leg swelling. So subsequent engorgement with that systolic vein producing pitting edema or enlargement of liver and patient develop ascites. So congestion of peripheral tissue, depending edema and ascites, liver congestion, but left side lung congestion. Liver congestion sign related to the impairment liver function, GI congestion, anorexia, GI distress, and weight loss. In this picture, we can see very short way to explain right side heart failure, loss of appetite because GI involved, lower leg edema because liver does not work well, also weight gain because fluid accumulate in the body. Left side, shortness of breath, upright respiration, shortness of breath and coughing at night, palpitation, fatigue, and tiredness. So it is more common sign for the patient who have the right or left side heart failure. Next question. For a client with a cardiomyopathy, the most important nursing diagnosis. Again, same question we talked before. Cardiomyopathy, right? It is a heart muscle disease. Okay, as I told you, it is inherited disease of the heart muscle, which makes it difficult of the heart to pump the blood to the other part of the body. So cardiomyopathy, the most important nursing diagnosis. Number one, decreased cardiac output related to reduced myocardial contractilities. Number two, excrete the fluid volume related to the fluid retention and altered compensatory mechanism. Number three, ineffective coping related to the fear of debilitating illness. Number three, anxiety related to acute threat to the heart sinus. Correct answer is decrease the cardiac output related to the reduced myocardial contractility. So here we can see the normal heart. So chamber relax and fill and contract to the palm. And here we can see heart with dilated cardiomyopathy. So heart fiber have a stretched and also heart chamber is enlarged. So rational said decrease the cardiac output related to reduce myocardial contractilities is the greatest threat to the survival of a client with cardiomyopathy. Although excrete fluid volumes, ineffective coughing, anxiety are important nursing diagnoses, the nurse can address them when the client has improved the cardiac output or myocardial contractilities. So same picture look, bigger here. You can get better image. Next question, when assessing a client with the left side heart failure, the nurse expects to note ascites, jugular vein distension, air hunger, and pitting edema of the lungs. So as I told you, the left side heart failure, which organ get involved? Our lungs. But right side involve the liver. So correct answer said air hunger. So rational said with the left side heart failure, the client typically has air hunger and other symptom of pulmonary congestion, ascites or jugular vein distension or pitting edema of the leg are the sign of right side heart failure. So in this picture, we can see normal circulation. But here we can see congestive heart failure when occur the circulation. The lungs is full of blood because of fluid back up in the lungs and congestion occur. So as I told you, the right side heart failure, liver get involved. Left side heart failure, lungs get involved. You see, fluid is accumulated in the lungs. Here. So when patient has a right side heart failure, usually occur as a result of left side heart failure. What does it mean? Usually patient has a complaint the left side heart failure, which is lead to the right side heart failure. Left and right both lead to the congestive heart failure or both side heart failure. So when the left side fail, increased fluid pressure is transferred back through the lungs. Here. And which is damage the heart right side. So this focus the blood back into the body vein because of right side, and patient experience visible swelling in the legs and ankle on the right side. Let me read it first. So blood enter left heart from the lungs. It is normal circulation showing. Number two, blood leaves the left heart enter to the systemic circulation. Number three here, blood from systemic circulation enter to the right heart, and blood level right heart enter to the pulmonary circulation. So it is easy way to explain. If you like, you can follow this picture again. Same thing. Left side heart failure, lungs involved, pulmonary condition, decrease the cardiac output when pulmonary orthopnea, cough and sputum, with sputum, paroxysmal nocturnal dyspnea is common. So activity intolerance, sign of decrease the tissue perfusion, so sinuses develop. At right side here, we can see congestion of peripheral tissues, liver get involved or liver congestion, impaired liver function, edema and ascites, our gastrointestinal system involved, GI tract congestion, anorexia, GI distress, and weight loss. This is the right side. Next question, with which disorder is the jugular vein distension is occurring? Distension prominent, abdominal aortic aneurysm, heart failure, myocardial infarction, or pneumonia. Yes, heart failure. So this is the vein we call jugular vein. Jugular vein. So when heart is failed, jugular venous pressure will go up, right? So this elevated the venous pressure, exhibited jugular vein distended. This is the vein. Indicate the heart fail to pump. Jugular vein distension is not a symptom of abdominal aortic aneurysm or pneumothorax. If severe enough, MI can progress to heart failure. But MI alone does not cause jugular vein distension. Here we can see the how to measure jugular venous pressure. So this is the sternocleidomastoid muscle, internal jugular vein, external jugular vein. So jugular vein distension like this is the vein, is when a vein on the side of the neck appears to bulging. It is the bulging vein. So a person has a jugular veins on both sides of their neck. So if it is left side, always another the right side. They act as a passageway of blood to move from a person's head and neck to the superior vena cava, which is the largest vein in the upper extremities or body. Next question here, a physician admit a client to the left healthcare facility for treatment of an abdominal aortic aneurysm. When planning this client care, which goal should the nurse keep in mind as she formulated intervention? So decreasing blood pressure, increase the mobility, increase blood pressure, reduce mobility. Number 3, stabilize the heart rate and blood pressure and easy anxiety. Number 4, increasing blood pressure and monitoring fluid intake and output. The correct answer is number 3. Stabilize the heart rate and blood pressure and easily anxiety. So this is the picture we can see, right? It is normal abdominal aorta, healthy abdominal aorta. So in this picture, we can see abdominal aorta. This is the thoracic part of aorta. Then aorta bifurcation occurs. So if any pathology, abdominal wall is abdominal, not abdominal, aortic, aorta wall is weaker. So it is easily bulging outside. So abdominal aorta with aneurysm. What is aneurysm? Aneurysm means the weakening part of the wall of aorta. We can see abdominal aortic aneurysm. So when it's weakening, when blood is go through, they put the pressure and they chance to rupture, and it is life-threatening medical emergencies. So aortic aneurysm is the abnormal bulge or bulging in the major blood vessels we call aorta. This is the aorta and bulging, which carry the aorta carry the blood from heart to rest of the body. And it can occur anywhere in the aorta or maybe in the tube from or round shape. So it is a tube and round shape. So it is medical emergency, I say. Let me read the rationale. For a client with aneurysm, nursing intervention focus on preventing aneurysm rupture by stabilizing heart rate and blood pressure. Easing anxiety or erasing anxiety also is important because anxiety and increased stimulations may raise the heart rate and boost the blood pressure, precipitating aneurysm rupture, right? The client with an abdominal aortic aneurysm is typically hypertensive, so the nurse should take the measure to lower the blood pressure, such as administering antihypertensive agents, right? Also to prevent aneurysm rupture. To sustain the major organ perfusion, the client should maintain a mean arterial pressure of at least 60 minutes of mercury. Although the nurse must assess each client mobilities individually, or most clients need bed rest when initiate attempt to gain stability. So nursing care is important if your patient have a aortic aneurysm. Keep it note, various nursing intervention for aortic aneurysm disease is we have to follow. We prepare the client for serial or a series of ultrasonography, which is conducted every 6 months to assess the size of aneurysm. We encourage the patient to avoid the strain during the defecation or give the glycerol suppository or enema to prevent the constipation, because when they push the pressure chance to rupture. Our target, don't pressurized or rupture it. So this is few question and answer for NCLEX exam. If you follow, I like to believe, I strongly believe it will help. It helps